Thank you very much, everybody. You'll notice that the three members of the panel have all been wearing face masks and will continue to wear face masks except when they speak. But I'm grateful to the media for turning up. I'm grateful to you for listening and watching. And I would like to express, as a politician, my gratitude to Dr. Brink and her team, to many other civil servants in their team, to Nick Hines, the Director of Education, his team, for the expedition. It's been 100 miles an hour since this new variant has been discovered. And as we already know, everybody in the world, I think, knows, we're responding to the emergence of a new variant known as Omicron. Now, there are so many questions concerning that new variant that nobody can answer at the moment. It'll take some time for our world experts to determine exactly what it means for the global response to COVID-19 and hence our own local response. But uncertainty alone is reason enough for us to take some precautions now. We can't just wait and hope. We've got to act in reasonable expedition and take reasonable steps. Now, already alongside the UK, a number of countries have been added to our red list with strict border testing and isolation requirements for anybody arriving or who's recently been to one of those countries. Now, we've identified some individuals who are already here, but recently travelled to the newly designated red list countries and invited them in for PCR testing. My sincere thanks to them for their cooperation. We have, as I speak at just after 6 o'clock on this particular evening, no cases of Omicron in the bailiwick so far, but Dr. Brink will talk more about that in due course. Today, the Civil Contingency Authority met and discussed a range of options for both our border roles and domestically. And this is what we have decided. We will again make it a requirement for all arrivals from the common travel area to purchase and complete a course of lateral flow tests when they come into the bailiwick. The common travel areas, I'm sure you know, is Jersey, the Isle of Man, the UK, Ireland, and of course, us. PCR tests on arrival will be reintroduced for fully vaccinated arrivals who've been outside the common travel area but not to a red list country. They will have to isolate until there is a negative result. Arrivals from outside the CTA who are not fully vaccinated follow the same rules as now, which means a day of arrival and a day 8 PCR test and isolation until the day 8 result comes back negative. These new rules will take effect from the moment that the clock ticks from the end of Tuesday and into the beginning of Wednesday. The UK has also introduced a PCR requirement for all international arrivals. Theirs is a day 2 test. But for clarity, if you're transiting through the UK from a non-red list, non-CTA country to here, you don't need to test in the UK as well. But that means that you have to stay in the airport or stay in the port. Otherwise, if you move out to go and see a show or to go to for a meal in a restaurant, you're then subject to UK rules. But so thus, assuming that you do transit in the way that I've suggested, you will only need to do the PCR test on arrival in the bailiwick. In the meantime, we're requesting passengers on services coming directly from outside of the CTA, such as the Barcelona flight and the ferry from France today, to undergo voluntary PCR tests as an additional precaution. As I've already mentioned, the red list is already in effect. Those who have been to a red list country must complete a day of arrival and day 9 tests and isolate until they've had their day 9 result. The practicalities are, with very limited exceptions, that if you are coming from a red list country, you'll come via the UK and you'll be required to complete a 10-day quarantine period in a quarantine hotel before you can continue on to the bailiwick anyway. Now, I'm sure a lot of you will watch the Prime Minister's briefing at the weekend and notes the announcement that the UK will also be making the use of face coverings mandatory in certain settings, in particular retail and public transport. Now, we've discussed that long and hard over the weekend and today, and we're going to introduce a similar measure here. To all of you who've already taken up the use of face coverings as recommended, thank you very much, and I sincerely thank you. The take-up has been good, very good in some settings, but there's no denying that in other settings it's been less good. We also know that our cases of Delta have still on the upkeep and still rising, but thankfully, and this is the crucial test at the moment, our hospital cases have stayed consistently low. However, with the emergence of the new variant and the uncertainty around that adds significant new consideration into the discussion on face coverings. Now, again, I emphasise we've not identified any cases of Omicron locally, but nonetheless, we feel it's proportionate to take the steps now in a proportionate and precipitative way. From Wednesday, it will be obligatory, i.e. mandatory, to wear a face covering in retail premises and public transport. Those are the settings where the use of a face mask is reasonably practical without impacting significantly on the lives and livelihood of the vast majority of islanders. We're not at this stage extending that to other sectors or venues where we know that mandatory face coverings would make business near impossible. We want to live with COVID as best we can. We want to be as practical as we can. But we do continue to strongly recommend face coverings in any settings where there are crowds or you cannot physically distance or ventilation is not good. So I would urge businesses in other sectors to look carefully at their policies and ask themselves, are there situations where their staff or customers could or should be wearing coverings, and can they do more to encourage that? Because if they can, they should. We also continue to strongly recommend regular testing twice a week with lateral flows too. But it's important, and I speak from personal experience, if your lateral flow is negative and you have symptoms, do not use that as justification to go out. You must stay at home and report those symptoms to the clinical health line. They will arrange a PCR test for you. Now, in a moment, I'll ask Dr. Brink to tell us more about what we know about Omicron and the mitigations I've just outlined. We're also very pleased to have with us today the Director of Education, Mr. Nick Hines, and I've not yet commented on schools, but Nick will be giving you an update after Dr. Brink has given her update. Over to you, Dr. Brink.
So, thank you very much. And if we go on to the first slide, please. So I think it's fair to say that the emergence of a variant of COVID-19, indeed multiple variants, has been expected. It's an RNA virus, and we always knew that we would see variants from the original virus that came out of Wuhan so many months ago now. But I think, although it's expected and predicted, and we've seen alpha, beta, gamma, delta, and so on, what we need to be cautious. And whenever a new variant arises, we ask ourselves three key questions. So we consider the transmissibility of the new variant, we consider the disease severity, and we also consider the vaccine efficacy. Now, those 3 points are absolutely key. Now, if you look at the transmissibility, there is some evidence of fairly quick growth in South Africa. Whether that's going to translate into high degrees of transmissibility or not, we simply don't know at the moment. So what we have at the moment is a high degree of uncertainty, and with that high degree of uncertainty, we need to be cautious. So that's transmissibility. Disease severity, indeed, there's also uncertainty about that. We know that some of the reports coming out from South Africa are suggesting a milder disease, but we simply don't know how that translates into different populations worldwide at different ages and so on. So I think that's important. Again, another big unknown there. And then we look at vaccine efficacy. Omicron has a large number of mutations, particularly in the spike protein, and that does give us concerns about vaccine efficacy. However, I'm going to enlarge on that a little more later and talk about the mitigations that we can use in such circumstances. And so if we go on to the next slide, what I've tried to do here is outline a timeline. And this is the bailiwick timeline. This is not the UK timeline. So this is what's happened to us. So on the 26th of November, in response to the evolving process that was happening worldwide and indeed in the UK, we put South Africa, Namibia, Lesotho, Eswatini, Zimbabwe and Botswana onto the bailiwick's red list. And at that time, we also went back onto our travel tracker and had a look at how many people had travelled into the bailiwick prior to us creating the red list. And we identified 32 people. The next day, on Saturday, Malawi, Mozambique, Zimbabwe and Angola were added to that red list by the UK, and we added them to the bailiwick's red list as well. At that time, an incoming traveller who had travelled from a red list country into the bailiwick and had voluntarily come forward for testing through our recall program tested positive for SARS-CoV-2, so the virus that causes COVID-19. And this is where our on-island sequencing capacity really serves us well. So at lunchtime, around about 2 o'clock, just after lunch, we identified this person as being SARS-CoV-2 positive. And what we then did is the sequencing team came out, and overnight they sequenced the virus. And by Sunday morning, we were clear that this was actually from the Delta lineage, so it was not Omicron. Now, that's really important because it enabled us very quickly to ascertain what our risk profile was. So there was an epidemiological risk in that this person came in from a red list country. However, we were able to sequence it and show that it was a Delta lineage virus conclusively and not Omicron. Now, that helps us in our management and helped us in how we proceeded over the course of the weekend. And we've continued through today with our normal testing and contact tracing, and I'll talk a little bit more about that in a moment, but I thought it was useful to highlight for you the weekend's events for us and how we've responded over the weekend period. And as ever, profound gratitude to the team who seamlessly went in. The sequencing is done by the States Analytical team. They came in and they sequenced overnight on Saturday night. So really a fantastic team response again. And if I can go to the next slide, please. So if we look at our Omicron mitigations, and when I was thinking about it, there are 3 spokes that we need to consider here. The first thing we need to do is we need to limit the importation of cases. And the second spoke is if we do have any cases locally, we need to limit the spread of those cases. And the third thing is we need to bolster our defences through our vaccination programme. So those are the 3 things that we're doing. And based on those 3 things, we've now designed our mitigation program. So we thought, what are our strategic aims? And those are our 3 strategic aims. And how are we going to design mitigation processes around those three aims? And if I can have the next slide, please. And so the first thing is looking at our border controls. We've reinstated some border testing, as our Chief Minister said. And that focused obviously on the red list. So the red list, all arrivals are being tested and will go into mandatory self-isolation. But we also looked at our non-CTA and our CTA arrivals. So non-common travel area arrivals, if they're fully vaccinated, we've reinstated a PCR test. The advantage of reinstating the PCR test is that if it is positive, we can go into molecular sequencing straight away and get a precise analysis of our risk. Non-vaccinated people from non-CTA areas, that remains the same. There's no change in the policies for that group. And then for CTA arrivals, what we've done is we've reintroduced lateral flow testing for that group of individuals. Now, of course, there has been some concern that the lateral flow tests might not pick up Omicron. And all I can say for that is there's a watching brief. We are looking at that carefully. And if any evidence comes out that that is indeed the case, then of course we'll relook at that policy. But we don't have any safety signal on that at the moment. So if we go to the next slide, please. So that's our external mitigation. So then we looked at what we could do internally. And that related firstly to our non-pharmaceutical interventions, and as our Chief Minister said, the mandatory face coverings in transports, on transport and shops. And again, it was looking at what we could do that was feasible to do, but at the same time enable the island to carry on with life. And I think that's really important. With lives and livelihoods, we need to work out what we can do in a feasible way. The next thing we've looked at is how we manage contacts of cases of Omicron, and how we've modified that. So if you're a contact of a case of Omicron, you can't do the daily lateral flow testing if you're fully vaccinated and go out into the community. You will need to isolate for the 10-day period. And that is a precautionary approach, and it reflects the uncertainty that we face. So all of this is precautionary, and it may well be in 2 weeks, 3 weeks' time, when we know more about the virus, we may roll back on some of these matters. So it really is just looking at what our concerns are now and what the uncertainties are now. If there's a suspected case, what we will do is ask that person to self-isolate until we've sequenced the virus and know whether it is Omicron or indeed one of the Delta lineage. So that's our internal measures, and then bolstering our defences that's through our vaccination policy. And if I go to the next slide, please, I'm sure you're all aware that the JCVI announced today the modifications in the immunisation programme. And we met with Health and Social Care, the Committee for Health and Social Care, at lunchtime today, and they've agreed on the extension of the vaccination programme as well. And basically what that's going to do is roll the booster programme right the way down to the 18 years of age. So we're already doing 40 to 49-year-old, and over 50s are well advanced, but we'll go down to 18 to 39-year-olds for the booster programme. Now, the logic of that is if you boost the immune response and you have a degree of mismatch between the virus and the vaccine, which we know with the multiple mutations that we're seeing with Omicron is indeed a risk, but if you bolster the immune response, you will get a better protection with the higher levels of immunity when you have a degree of vaccine and virus mismatch. So that's the scientific logic for that. The aim of the booster program also is to make sure that we have as much immunity as possible with regard to protection against Omicron, because if it does turn out to be really transmissible and we move into another wave of infection, we will have then vaccinated as quickly as we can to ensure that we have the highest degree of protection. So that's important from the boosting program. The second point about the boosting program is to bring the time down between the second vaccination and the booster, and that's going to come down to round about 3 months. Then we're also going to be offering boosters to people who are immunosuppressed who had to have 3 doses of vaccine for their primary response, and they will then get a booster program, a 4th booster dose of vaccine. And the final thing is the extension of the 2nd dose of vaccine for the 12 to 15-year-olds. So those are all in line with the JCVI program, and we will be looking at this operationally to see how we can roll this out as quickly as we can. So if we go to the next slide, please. So I'm going to move away from Omicron now. We've spoken about the precautionary approach that we're taking. We've spoken about the mitigations that we're putting in from a bailiwick-wide bailiwick-wide perspective. But we've also said that these are, at the moment, we're in a situation of unknown, and once we've assessed the situation, we may well be able to roll back. We just don't know at the moment. But what I thought I'd also do is update you on where we are with our 3rd wave of infection. And as you can see, we are sitting at round about 93 cases a day in our 7-day rolling average. So we've got a significant 3rd wave of infection, and that indeed is all caused by the Delta variant of concern. About just under 30% of our cases are caused by the so-called Delta Plus variant. So that just shows you where we are here. And if we go to the next slide, we can look at the breakdown of active cases. Now, what you can see from that is you can see the very high number of cases in the 10 to 14-year-olds, and you can see the predominance of infections in children. Now, I think that's important, but also what is encouraging, if you look at the top end of the graph, you'll see that the number of cases in people above 70 years of age is beginning to decrease, and that probably is due to the efficacy of the booster program. So we're starting to see a decrease in the number of those cases in the older age group. So that part of it is encouraging. And Nick Hines will be talking more about education in a moment. And if we go to our final slide, please, and as ever, we have our vaccination program, which remains important with Omicron as well. So that's our boosting program to get ourselves as protected as we can. But all of those other mitigations, so the mitigations we're using at the moment that we're introducing today are all part of a suite of mitigations that we knew we had to help protect the bailiwick in these uncertain times. Thank you, Deputy Fair Bush.
Thank you very much indeed, Dr. Brink. Now, we focus today, as we would expect us to do, on the emergence of the Omicron variant, but we have now for several weeks been managing rising cases of the Delta variant, whether it's the Delta variant or the Delta super variant. As Dr. Brink has just shown us, those cases continue to rise, 93 a day on average. Unlike Omicron, though, we know a lot more about Delta. We know the vaccine offers very good protection, and we know for most people it will mean a mild illness. Now, I'm going to ask the Director of Education, Nick Hines, to speak just in a moment. And again, I would like to thank Nick, his team, the teachers, assistants and parents for all their efforts because they've really been on the front line for the past few weeks. and been battling this situation daily. So on behalf of the people of the Bailiwick of Guernsey, I thank them. Now, the CCA discussed with our colleagues at Education, Sport and Culture earlier today, and we can see that the number of cases, as Dr. Brinker said, in young people is still rising. So Nick is with us today, and we'll talk about the steps education settings will be taking. Nick.
Thank you, Deputy Fairbrush. Good evening, everyone. And this is my first COVID media briefing. I just wanted to say that I'm pleased to be here to provide an update on how we're managing the implications of the virus in education settings. And hopefully I'll be able to answer any questions that colleagues in the media might be able to might have. I know the rising cases have caused a degree of anxiety, particularly as staff, students, parents and carers have had to adapt to the changing circumstances around using lateral flow tests. As a result, we've seen a large numbers of contact traced and increased amount of face coverings on school grounds. It's certainly a challenging time as we all focus on the priority of keeping education settings operational with as little disruption as possible to young people's education. While the number of COVID cases amongst students and staff is relatively low when compared to the number of students and staff, it's important to recognise that there are wider implications and challenges at the moment. We all know that there are lots of seasonal bugs around, so we're seeing students and staff absences as a result of being off with symptoms while they wait for a negative PCR test result. Staff have also had an increased workload as a result of undertaking significant contact tracing administration. I know staff are stretched at the moment, and for a variety of reasons, I'd really like to thank all of them and school leaders for doing all they can to manage these challenges. As a knock-on effect, we're also seeing an increased demand for supply teachers and learning support assistants. And I'd like to take this opportunity to say if there are any qualified teachers or learning support assistants in our community who will be interested in carrying out additional supply work, please contact the Education Office. We know that there has been a lot of discussion around face coverings and their use in education settings. And for us, from an education policy perspective, working very closely with our colleagues in public health, we've tried to strike the right balance between risk mitigation and remaining proportionate to that risk. It's also really important to remember that we also have a suite of mitigations already in place in education settings to help minimise the risk of transmission. Since we introduced an expectation that face coverings would be worn by all visitors when on school grounds, we've received an excellent response from parents and carers. While the response was also great from staff in most schools, when face coverings were strongly recommended in communal areas, we're also aware that the take-up has not been consistent everywhere. And it has undoubtedly been a challenge to encourage all secondary and post-16 students to wear face coverings. We've been reviewing our policy and have now taken a decision that from tomorrow we're strengthening this so that face coverings must be worn in certain situations. In secondary schools and post-16 settings, all students and staff must now wear face coverings in communal areas. This does not include classrooms, and I'll come back to why that is in a moment. But it does include places such as corridors, common rooms and halls, for example. In primary schools, the same rules apply, but for staff only. There remains no expectation that primary age students should wear face coverings. However, if they're keen to do so, we will of course support them. These changes are being introduced to try and increase protective measures for staff and students in the run-up to Christmas. Some of you may have seen that the Department of Education in England issued its latest guidance yesterday, which maintains the strongly recommended position in communal spaces. We're taking a slightly stronger stance based on our specific current challenges. In terms of enforcing this new policy, while no student will be excluded if they refuse to wear a face covering, our expectation is that it will be followed by all who it applies to, in the same way as if it was another school rule. We are confident that our staff will do the best to enforce it proportionately and that our young people will also act responsibly. I know that there has been some discussion and questioning about why we're not making secondary and post-16 students wear coverings in classrooms, so I just want to briefly touch on why that is. As I mentioned earlier, face coverings are just one of the suite of mitigations in place in our schools. In terms of classrooms, we're ensuring that they're well ventilated, with windows open. We have CO2 monitors in place to help ensure that there are appropriate levels of ventilation. Students and staff are regularly washing their hands and using hand sanitizer, and students are being spaced out as much as is possible. Of course, this is all about proportionate mitigations that disrupt learning as little as possible. At this stage, we don't believe it would be proportionate for students to be forced to wear face coverings all day. There are other mitigations in place in classrooms, as I've just said, which we believe act as a way of making sure that students and staff can be as safe as possible. I'm also aware that there has been some discussion on social media about whether terms should end early. It's been described as an education circuit breaker. I just want to clarify that at this stage there are no plans for schools to finish early for Christmas. We're focused at the moment on risk mitigation and minimising disruption to our young people's education. Just before I hand back to Deputy Fairbrush, I want to take this opportunity to clarify the advice given to all schools about events. Following discussions with Public Health, we issued guidance to all school settings. The Public Health advice was that events could go ahead with sensible mitigations in place. However, in recognition of the wider challenges facing schools at the moment, we encouraged each of them to make decisions on whether they should go ahead based on their own circumstances and risk assessments. That's why some schools have decided to go ahead, whereas other events have been postponed. Again, we felt this was appropriate and proportionate to leave these decisions to schools themselves while making sure that they're fully aware of the advice from Public Health. Thank you. I hope that has helped clarify the current position in education settings. Now hand back to Deputy Fairbrush.
Thank you very much, Nick. That is indeed very helpful. Ladies and gentlemen of the press, it's your opportunity to ask questions.
Good afternoon, panel. Juliet from the Guernsey Press. Can I just start by saying it's very nice to see Deputy Fairbrush back and healthy with the panel today.
Thank you.
I think I'm going to start with a question to Dr. Brink, if that's all right.
Of course.
Thank you very much for giving us the details of the booster programme. I see that there's lots of people going to the drop-ins for the over 50s. I know we already said that we could have over 40, but I haven't seen any drop-ins for that yet. Do we have any timescales for when we'll start seeing the ages going down? What's going to happen for the rest of us under 50?
So invitations have gone out for the 40 to 49-year-olds, but what we are going to do, we only got the guidance this afternoon from JCVI. We'll be working operationally, led by Jason Moriarty and his team. We're working to outline how we can roll out the programme. So really important, our intention is to roll this out as quickly as we can. Because I said there are two reasons for having a booster programme. The one is when you have a mismatch between a virus and a vaccine, by boosting and getting a stronger immune response, you'll get greater efficacy. The second is, should we go into a wave of Omicron, and we don't know what's going to happen, is to have as much immunity before you hit a wave rather than trying to establish that during a wave would be advantageous. So we'll be looking at doing this as quickly as we can, but we haven't worked out the finer detail yet. But we're on the case.
In an ideal world, what sort of age group do you hope to have had their booster by, let's say, Christmas? Because a lot of people are quite keen to have it before having family gets-togethers, for example. Where would you hope we are in an ideal scenario?
I just can't give you precise detail on that, but we should be able to give you some detail in the days to come. So we need to sit down now, look at the numbers, look at how many vaccinators we can get in, look at how much we can extend the days. So we want to try and look at 3 sessions a day. So we're looking at extending the days, so extending the times, extending the number of days we offer it a week. But we need to map that out and work out exactly who will be able to get done by when. But it is our intention to do it as quickly as we can.
Okay. Next question. Yes.
Yeah, thank you, Deputy Fairbrush, Matt Fallais, Bailiwick Express, and it's good to see you healthy and recovered from COVID.
Thank you.
Can I ask you, 2 or 3 weeks ago, you said that our testing capacity was perhaps at its maximum or getting close to its maximum. And I think at that stage we had around half the number of cases that we presently have. What has happened to our testing capacity since then?
It's still under strain. Dr. Brink, I think you can add more really than me.
Yeah. So we're testing about 500 odd symptomatic people a day, so we're testing large number of symptomatic people. We know by testing at the borders for the non-CTA arrivals, we're going to have to extend the days that we prefer, extend the day. So again, going on into evening runs again and so on. So we're going to have to accommodate the extra testing. And I spent some time today talking to our head of pathology services, Paul Sutton, and he is very much a can-do person. So he's looking at how he can model that out. And again, we are incredibly grateful for, once again, the team just steps up and provides the service that the bailiwick needs. And we've got to be we're incredibly fortunate from that point of view.
Okay, so you're not overly concerned that the additional testing requirements, which now need to be imposed, will place an undue burden on the team at this stage?
I think it'll stretch our testing capacity, but the modelling that Paul Sutton has done, he feels that they will be able to cope.
Next question, anybody?
John Fernandez from BBC Guernsey. Lateral flow tests have been free for weeks now. You've been able to pick them up at Beausejour, at the information centre, and now you're asking for money again for them at the border. We know that continuity of tests is what you're looking for at the border, but can you see why people are going to be frustrated by this, and can you explain why this charge is returned?
The cost to the taxpayer, if they were given out free, between now, and we're at the end of November, and the end of December, would be £120,000. That's the cost that we have to bear. When I say we, I don't mean the state of Guernsey. I mean the people of Guernsey who pay their taxes, and the bailiwick people in Alderney, etc., pay their taxes. So this is a mandatory requirement, and we're saying to people, if you do travel, then it is going to cost you £25. Now, expressing my personal view, I think that's a perfectly reasonable sum for people to meet, bearing in mind that this has been a very, very expensive exercise for the people of the bailiwick of Guernsey, and we are still a long way from emerging through the COVID-19 scenario. It's going to be with us for a long time. We've just had this new variant which came about in the last few days. You've heard what Dr. Brink has said. There could be more restrictions. Let me also say, you haven't asked the question, we're going to answer it anyway, is that we are a long, long way from a lockdown. Nick has dealt with the question about schools and not closing early, etc., etc. At the present time, we do not envisage, unless something completely untoward happens, that we'll be bringing a partial or full lockdown in the immediate future. Dr. Brink.
Yeah. So just one other point about the lateral flow tests is the supply that we give to people to do for surveillance testing and indeed for contact tracing, we get from the Department of Health and Social Care in the UK, and we're incredibly grateful for that supply, and it is provided to us free of charge, but specifically not for travel purposes. So it's really important that we respect the conditions by which we've been provided with these tests, because they are fundamentally important to our programme now. We're using them in contact tracing, we're using them in surveillance testing, we're encouraging people to take them if they're going to a high-risk situation, for example, going into a care home to visit a relative and so on. And so that supply of testing is going to be central to our response over the winter period.
Thank you very much.
Kate Pratt from ITV Channel. It's a question for Nick, actually. Given the changes in schools with mask wearing, do you envisage that having an impact on things like end-of-year performances, plays, parties, things like that?
It's fair to say that it's already had an impact on many of those, and schools are taking a proportionate view and carrying out risk assessments about any different activities or nativities or school fairs that they're putting on. And dependent on the environment that they're due to operate in those, they're looking at whether they can put mitigations in place to continue, or taking a view about whether they need to do something alternative or cancel. So, for example, we know that some of the parent-teacher interviews that took place last week took place online, and we know others were done via social distancing. So each different education setting is looking at each event that it's putting on and deciding whether they can go ahead within their environment or whether they need to cancel and put additional mitigations in place.
And you think you explained, Nick, in your earlier comments, it's down to the individual school, isn't it?
Yes, it is.
So they'll make the decision based on their particular circumstances. It'll no doubt vary from school to school for good reason.
Can I ask two questions on PCRs, just for two quick scenarios to clarify things? Firstly, a lot of people, if they're travelling from Europe into Guernsey or spend the night in the UK, will they still then be okay to travel on to Guernsey and do their PCR here rather than in the UK? And secondly, if someone, let's say, travels to the UK, spends 5 days in the UK, sources their PCR there, will they then need to have their test in Guernsey when they come here as well? Because it will be within 10 days of them coming from Europe to here. Can you clarify on those two?
Yeah. So if someone is transiting directly into the bailiwick, So in other words, going into Gatwick and then moving straight on, then that's absolutely fine. They can get the test when they arrive here. However, if they're going to spend time in the UK, then they'll have to adhere to the UK policy. And then when they came back into the bailiwick, the travel tracker would categorise them appropriately, but they would have had their test on arrival. Yeah?
Would that also mean that people who maybe swap airports, let's say from Heathrow to Gatwick, then would have to follow the UK rules first and get tested there?
If it's a direct transit, there's specific rules on our website. If it's a direct transit, it's fine, but you can't go and visit a few friends, go and see a show, and then come over to the bailiwick.
I have two questions about the on-island additional measures that you have announced today. The first is, are you able to articulate expressly what is meant in the difference between strongly recommended and mandatory? So what happens, for example, if a person is in a place where they are obliged to wear a mask or a face covering, and they choose not to and they don't have a medical exemption? And secondly, Dr. Brink's counterpart in the UK has said that he has become concerned about the reluctance of people to comply with any new measures introduced because of the length of time this has been going on for. Do we have those sorts of concerns in the bailiwick as well?
Well, the answer is yes, we do. But let's say from Wednesday you've got to wear a mask in a shop. Now, if you don't wear a mask in a shop, you technically commit an offence. The idea is not to prosecute people unless it's absolutely necessary. The difference with the school setting is it's strongly recommended, communal areas, etc., etc. They will impress, and they have impressed and will continue to impress upon students, teachers, etc., the sense of the good sense of wearing those. So it depends. It depends on the particular instance. Where there is a regulation, and we intend to make those regulations formally tomorrow. They're being drafted, as you can imagine. You would know from your own experience, they're being drafted, quotes now, close quotes, and will come into force on Wednesday. But the idea is encouragement, asking people. Nobody wants to prosecute anybody for anything. That's the last thing anybody wants to do. But if there is abuse and prosecutions are necessary, we've already received a response from the head of law enforcement. They will be able to enforce it. But we hope that's not necessary. Do you want to add anything, Dr. Brink?
It has been going on for ages. And I think everyone is tired of COVID now. But unfortunately, it's not over yet. And I fully sympathise with people. I mean, I look at my own team, and many of them have young children, and they've given up countless weekends and evenings working. And it's been going on a long time. And so I think, it's quite understandable, but unfortunately, the pandemic is not over yet.
No. It's gone to another level. We're controlling it. I'm sure we will control it. But people have got to step up a bit, as we've indicated. Nobody wants to make any restrictions. Nobody wants to prosecute anybody. But that's got to be a weapon in the armoury. Anybody else with a question?
Yep, one more from me. So a number of Guernsey residents are in South Africa at the moment. They say they're stuck because of cancellations to flights following the Red List decision. How are you planning to repatriate people from there? Is it something you'll be doing with the Foreign Office, or is it something you guys can do yourselves?
Well, I'm sure we'll do whatever we can to assist. But ultimately, unless you can fly directly from e.g. South Africa to Guernsey and you've still got the test that we've referred to, you would still have to be isolating for 9 days effectively. But otherwise, you do your 10 days at a quarantine hotel in an airport in England. There's not much we can do, really, but of course we'll give whatever practical assistance we can, but in reality it's a difficult situation. Anybody else with another question? Julia?
We've seen a number of people posting online about, obviously, their concern around children going into schools when there are obviously quite a few COVID cases, and some saying they'd like to take their children out of school because they've got specific concerns. What is the situation in that case? Can parents choose to take their children out of school if they're worried about the COVID situation in the school? And what could happen if they take them out without permission?
Nick?
Well, we wouldn't, we wouldn't support necessarily parents taking their children out of school at the moment. We believe the mitigations we're putting in place are to keep all of our students and staff safe. If parents had particularly high levels of anxiety, I would encourage them to go and speak to their head teacher. and talk about what's in place within school, and hopefully the head teacher will be able to give them some confidence that the mitigations that are in place to keep their young person safe will give them some confidence to keep them in there.
Anybody else on the question? Matt?
I have one final question for Nick, if I may, which is that we know that the absence rate across the whole term is, I think, 90% or above 90%. But that obviously takes into account a period before half-term when there weren't that many cases. So do you have the latest figures for the absence rate that is now being experienced in schools?
Yeah, I do actually. I've had some data just today for last week as well. So what I can share is that our typical rates of attendance at this period of time, pre-COVID, it seems like a long time ago now, within primary schools would be over 96%, nearly 97%, and our secondary schools almost 95%. At the moment, as of today, our attendance in primary schools was 80.6%, and our attendance in secondary schools was 76%. Of those that are absent today, we had 3.6% of young people directly due to COVID, and 4% of young people within primary schools who are self-isolating due to awaiting a test result or waiting for a test. And similarly, in secondary schools, 4.1% of our young people with COVID and 3.4% who are self-isolating or waiting for a PCR test. So it's fair to say that in the last couple of weeks in particular, our attendance rates have dropped, but I do want to take the opportunity to say that, our school leaders and all of our staff in schools are working so hard at a time when we know staffing is stretched, and our focus is really keeping schools going and making sure that those young people and their families can rely on schools to provide that support and that quality education that we know all our schools can do.
And the teachers and the teaching assistants have really stepped up to the mark, haven't they?
They've absolutely been fantastic, and that's all staff, whether they're directly in front of children or not, whether they're the people taking the young people to school or offices or anywhere else in the school.
Anybody else with any other question? Yes, Julia.
I've got a quick question about testing. I'd like to say, firstly, thank you very much to your testing team. I know they've been working incredibly hard, and I've seen some stats today which shows they've been getting busier and busier over the last month. Obviously, in the run to Christmas, we are going to get busier, and you talked about, we're going to put increased things in place, like extra staffing and longer hours, to try and make sure the PCR testing goes smoothly. But do you have, for example, when you post something passed off for Christmas, you have a final postal date. Do you have a final date you'd recommend people arrive in the islands so they can have a negative PCR test to spend time with their family at Christmas? Would you recommend 2 days before, or when would you say is the final?
You're talking about they're coming from the non-CTA areas. So if they're coming from within the CTA, they'll be doing lateral flows every second day. So that isn't dependent on them getting a PCR. From people coming from a non-CTA or from a non-CTA area, I would allow at least 48 hours. I think it's really important because we've no idea how busy we're going to be at that time. But I have to say, I can recall last Christmas is we worked our socks off to get everyone to their families by Christmas Eve. So we'd obviously do our very best endeavours, but I'd give at least 48 hours. I think the other thing I would say, Juliet, at this stage is we're going to see what happens over the next 2 weeks. We're in a volatile situation at the moment. We don't know how Omicron is going to play out. We don't know if it's going to be something that we're not too concerned about in 2 weeks' time, or whether we'll be going into a wave of infections. So it's an uncertain situation at the moment. So I can't give any cast iron guarantees what it's going to look like the week before Christmas. I'm so sorry.
Anybody else anything else?
Last year there was Operation Jingle Bells to get university students back. Now this year, obviously we've not heard anything about a programme now. Will there be any kind of programme to get students back, and will they need to pay this £25 lateral flow fee when they're coming back?
At the moment, the answer is yes. Because the answer is yes. I mean, if circumstances change, we will announce a change. But at the moment, they must expect to pay the £25.
But I think, Nick, your team's also looking at how you can get the students back, aren't they?
Yeah, I mean, as for last year, we are looking into how we might have to do any operations for bringing students back, but we haven't put those live yet.
Okay. Anything else?
the English Health Secretary, Sajid Javid, said if this new variant is found to be no more dangerous than Delta, then the latest measures will be removed. Is that going to be the same for Guernsey, Deputy Fairbrother?
Again, we'll look at that, the circumstances as they are. The likelihood is, if it is no more damaging than the Delta variant, that the restrictions will be lifted very quickly. But that's going to take a time, because I very much respect what the Secretary of State says, but that is going to take a time. His own Prime Minister said just at the weekend, we're looking at 2 to 3 weeks. And I would have thought that's the kind of time period that we can look at. It's not going to be suddenly tomorrow that Mr. Javid is going to stand up, or Mr. Johnson's going to stand up, or one of their scientists is going to stand up and say, we've looked at it now, it's all done. The World Health Organization is looking at it, lots of intelligent scientists are looking at it.
We're also upping our sequencing of local isolates, so we're trying to now sequence about 10% of our local isolates so we can get a good handle of what's happening in our local population. So all of this forms part of the COVID response.
I think we're probably there. Thank you very much, everybody. I'm grateful to the media for your perceptive and constructive questions. As always, I'm grateful to Dr. Brink and her team. And Nick, thank you very much for coming along and explaining the education system and your concerns so well. Thank you very much indeed, and good evening, everybody.